with respect to an ACL injury. Most of these injuries happen to athletes or somebody who's involved in a sporting activity, whether you're doing athletics daily or just a weekend warrior. And the injury can be the result of being hit by somebody else, which we call a contact injury, or it can just be landing awkwardly or stopping suddenly and finding yourself in a bad position. You may feel a pop, notice you get some swelling after that. That's called a non-contact injury. And most of these injuries actually are the result of a non-contact injury. So when we talk about the anterior cruciate ligament, which is more commonly referred to as the ACL when we read about it, this is looking at a knee. This is the right knee of somebody. This is the inside part of the knee. This is the outside or the lateral side of the knee. This would be your kneecap right here. This is the femur or the thigh bone, the tibia or the shin bone. And if we look inside the knee, what we see here is this is the meniscus on the outside, the lateral meniscus or cartilage. This is the medial meniscus or cartilage. And there are two ligaments on the inside. They're called cruciate ligaments. There's the posterior cruciate ligament and then the anterior cruciate ligament. What we're talking about is the ACL, which runs from this femur to the tibia. And the primary function of that ACL is to really stabilize the knee joint, restrain the tibia from going too far forward on the femur. So if you tear this ligament, if you're active in cutting, pivoting, what we call at-risk activities, the issue is that the tibia tends to slide forward too far with those activities, and that creates an instability, or the patient feels like my knee is giving way. That can lead to other issues with the knee as well if that continues. Once the ACL tears, the other structures have to make up for some stability, and the medial meniscus over here actually makes up for the majority of that stability, which is why we see in a more chronic situation, meaning that your ACL has been out for a while, and with repeated injuries, that the medial meniscus oftentimes will become torn.